Hey, everybody, welcome back to another episode of Confessions of a Male Gynecologist. I'm your host, Dr. Shawn Tassone, practicing gynecology hormone replacement in Austin, Texas. Did you know that I am licensed in 48 states across this country? So if you live anywhere in the United States, with the exception of Massachusetts or Alaska, I can see you via telemedicine. So if you are struggling with weight, with insomnia, irritability, anxiety, hot flashes, vaginal dryness, the whole nine yards, I order labs wherever you live. You'll meet with me. We'll come up with a great plan. I'll see you 6 weeks later. And then after that, we touch bases every 6 months. I don't take insurance, but if you wanted to start somewhere else, you can get my book, The Hormone Balance Bible. It's on Amazon for like $16. Talks about the 12 most common hormone imbalances that I've seen in the last 25 years in women, breaks it down into stories, archetypal language so you can understand things a little bit better. And it gives you a 6-step process called the Shines Protocol to help you alleviate those problems if you don't have the time or money to see an actual physician. I can give you some recommendations to try and see where you're at. I also have a quiz to find out maybe what's going on. www.tassonemd.com/quiz. So I talked about in my last episode estrogen to kind of give people a primer on estrogen, what it means, what it does, the different types of estrogens in your body, prescriptions and stuff. In this episode, I wanted to focus on testosterone because testosterone is the number one circulating hormone in a woman's body throughout her reproductive life. More than estrogen, more than progesterone, more than DHEA. It is the number one hormone. And then what happens is when women have low testosterone, they're blown off by the medical profession because, well, they don't even like to talk about testosterone. Now, testosterone is an interesting hormone. In women, 50% of it is made in the ovaries, and the other 50% is made in the adrenal glands. So you have two systems that are working simultaneously with your testosterone. I see testosterone deficiency as the number one hormonal deficiency in women across the board, all ages. 20-year-olds, 30-year-olds, 70-year-olds, doesn't matter. Number one thing I see across the board. And there's lots of different reasons for that at different ages. In younger women, it's usually the effects of birth control pills because birth control increases sex hormone binding globulin, which then lowers your free testosterone. In perimenopause, things like sleep, weight, exercise levels can all affect your testosterone. And then obviously, when you go into menopause, the testosterone production from the ovaries drops. So you're going to get an immediate drop of your testosterone by about 50%. And testosterone is responsible for a lot of things, including mood, activity levels, drive, desire, muscle mass, bone density. There are a lot of benefits to keeping your testosterone at a healthy level. And that varies from women to women. Now, you also have to keep in mind that testosterone on a lab is a huge range. If you look at free testosterone, because that's the testosterone that matters, most physicians, first of all, only order a total. The problem is the total testosterone isn't going to tell you what the level of active testosterone is in your body. That's a free testosterone. So if you're getting labs drawn, you want to make sure you're getting a free testosterone drawn so you can see what the active part of testosterone is in your body. The range on a free testosterone is 0.2 to 6.4. That is a 32-fold canyon where you could be technically normal. So let's say you come into the office and you're at 0.2. Doctor's going to look at that and say, oh, testosterone's normal, if you can even get them to draw it in the first place. So if they draw it and they say, well, it's normal, well, where in the normal range? Because I look at normal, and I might have mentioned this in my estrogen podcast, normal just means that you're in the house. Okay, where are you in the house? If you're 0.2, 0.5, you're laying on the floor of the basement. That may not feel very good to you. So what are the symptoms of low testosterone? Well, you're going to be looking at things like fatigue, especially in the afternoons. And I'm not just talking about like one day you're kind of tired. That happens to all of us. What I'm talking about is an undeniable fatigue where you just, women tend to power through, get stuff done because they have to. But this is a fatigue. I just had a lady this morning kind of describe it as she's pretending to feel okay. She's pushing through, decreased drive, motivation, desire. And when you're tired and you don't care, then sex drive takes a hit. Muscle mass can go down. Recovery can take longer. You may not sleep as well, believe it or not. Bone density can go down. And testosterone is responsible for your mood. So you might feel kind of depressed, kind of bummed. Just, I often describe it as if it was a t shirt, it would just say meh or blah or something like that. So if you feel any of those, I would definitely ask your doctor to check your testosterone. If they won't, and I say this all the time, you're never going to convince a doctor to do something they don't want to do. So if they don't want to do it, then find somebody that will. Somebody like myself or somebody else across the country that's checking testosterone levels. Now, for the most part, testosterone is a steady state hormone. The only time usually that your testosterone will alter is when you ovulate. When you ovulate, you will have a surge of a hormone called luteinizing hormone that comes from your pituitary gland. And what luteinizing hormone does is it stimulates a cell in the ovary called the theca cell, and theca cells produce testosterone. So you get this massive bump of LH, stimulates the theca cell in the ovary, and you make a really large amount of testosterone. So if you have a very good testosterone level, but you still have all the symptoms, fatigue, hair thinning, just feeling meh or blah, and your doctor says it looks like your testosterone levels are great, ask them what your FSH and LH are. If your LH is really high and you're not menopausal, because that's the other reason an LH could be high, then it might have been that they got you while you're ovulating. And so maybe that one day your testosterone was great, but the other 29 to 32 days, it's really low. So for a doctor that actually knows what they're doing, they can draw a testosterone level at any time in your cycle and kind of figure out what's going on. Don't ever let a physician tell you that because the labs, because the hormone levels fluctuate daily, that we can't draw labs. That's lazy. That's garbage. I hear it all the time. That is a doctor just flat out telling you that they don't want to do it. They're gaslighting you. And the reality is that they're wrong. I'll just put it out there. In my opinion, that's just wrong and lazy. So people will often ask me, what's a good testosterone level? And I'm kind of the belief structure that this whole concept of optimal levels, it's a myth. It's a myth made up by functional medicine practitioners that want to sound like they know something more than the medical establishment. Optimal level is where you feel best within the normal range. And I put that proviso in there about the normal range because there are even physicians out there that have been trained by these, in my opinion, shitty companies like WorldLink, BioT, and Evexius who think that it's okay to have a testosterone level of 200 if you're a woman. And I'm here to tell you that's malpractice. Any physician out there telling you that it's okay to have a testosterone level of 150 or 200, in my opinion, is committing malpractice, and they're negligent because that's abnormally high. There's no reason why a woman's hormone levels should ever be that high as far as testosterone goes. And the reason being is because high testosterone in women can add to high blood pressure, elevate your bad cholesterol and lower your good cholesterol. It can cause the clitoris to enlarge, and it can cause your voice to deepen. It can cause male pattern baldness and all kinds of stuff. So even though, and I have this all the time, women will tell me, oh, my testosterone is 150 and I feel great. Okay. Well, cocaine can make you feel great too, but nobody's out there promoting that. And the reason for that is because long term, it can be detrimental to your health. Exact same thing with testosterone. So, any doctor out there on Instagram, and I've had one anesthesiologist in particular who looks like a man, if you ask me, and then there's another health influencer out there who looks like a man, square chin, big head. They will tell you it's okay to be high. Oh, I've been high for years and I'm fine. No, you're not. You look like a man. Now, if you want to look like a man, which can happen in transgenderism, that's fine. But if you want to look like a woman, don't overdose yourself on testosterone. So basically, let's say you're low in testosterone and the doctor offers you testosterone replacement. There's different ways to do testosterone replacement. There's topical creams, sublingual tablets, capsules, and then the horrible pellets and injections, which I'll talk about at the end. The creams are a good starting point. Creams you can have compounded. First of all the hormone replacement for women, in my opinion, needs to be compounded. If you have a doctor that prescribes you a testosterone replacement that you can get from Walgreens or CVS, that is a male dose. I will say Kelly Casperson, Sharon Malone, those doctors with the menopause, they for some reason think it's okay to prescribe you a packet of androgel and tell you to only squeeze out 1/10 of the packet. Tell me, when you have a runny gel that's like watery, how you're supposed to squeeze out 1/10 of a packet. It's physically impossible. Most women that I see that are using this technique have testosterone levels through the roof. And it's because they're trying to do 1/10 of the packet, but you can't. So these women that are prescribing these hormones and talking about testosterone replacement, they won't compound because they're afraid of compounded hormones, because compounded isn't technically FDA approved. The hormones are FDA approved, but the compounding isn't. They'll prescribe you a male dose of testosterone, which is definitely not FDA approved. So they're hypocrites and they're contradicting themselves. And it's just because they're stubborn as hell. They only follow the teachings of the Menopause Society, which, in my opinion, is an outdated group of practitioners who gaslight women all the time. And because they don't want to push the envelope, they just prescribe you a male dose of testosterone. Totally wrong, in my opinion, and technically lazy and disgusting, if you ask me. So don't use androgel. It is cheaper if your insurance covers it, but you're going to pay the piper in the long run. So a topical cream is a compounded dose for a woman. In about 95% of the cases, it works great. You just have to find the dose that's right for you. Most of your compounded hormones cost about $50. Shouldn't be $100. If it's $100, find a new compounding pharmacy because they're gouging you. You can put anything in the cream: estrogen, testosterone, DHEA. You can combine them. Amy Horniman is out there talking about how she doesn't want you to mix the hormones because they don't absorb. First of all, she's not a doctor. She can't prescribe anything, and she doesn't know what she's talking about, in my opinion. So I wouldn't follow anything she teaches. I've been doing this for 25 years, and it works fine. And it saves you money. So if you combine all the hormones, it usually doesn't increase your price. So that's that. Creams work great, but in about 5% of the population, I can't get the cream to absorb through your skin, no matter what. Doesn't matter how I go up on the dose, it's just not going to absorb. So in those instances, we go to either a sublingual lozenge called a troche, rapid dissolve tablet, or we go to a capsule that you swallow. The sublingual tablet works great. You put it under your tongue, it goes right into your bloodstream. The only downside to a sublingual tablet is that it hits you all at once because it dissolves, right? So you get all of the dose at once. So you're going to get a bit of a peak in about 2 to 3 hours, and then it slowly dissipates over the day. Occasionally, I'll have a woman that will say, I feel great in the morning. I'm a little bit tired in the afternoon. If that happens, what I have her do is cut the troche in half, do half in the morning, half in the afternoon. So instead of getting that huge morning bump, you'll get a little morning bump, and you'll get a little afternoon bump. If women don't like it because they don't like the taste, or it makes their lips feel tingly or something, which can happen, then I'll move to a capsule. This whole fear of oral hormones really is unfounded. Testosterone in particular is absorbed lymphatically, so it doesn't necessarily go through the liver. The problem with oral meds is that you might lose some of it to the digestive tract or the acid in the stomach. So it's worth a try. I have a lot of women that use them. Majority do great, but sometimes I can't get levels up very well doing that, and I will go back to a sublingual. Now, let's talk about the evil that is testosterone injections and pellets. The problem that I have with those delivery methods is that there is no way to dose them that is safe for a woman. These medications were made for men once again. So I have women that do injections and pellets come to me all the time, and they are notoriously high. They are in the 100s, 200s. I've seen them as high as 500. And the the lesser of the two evils would be an injection. But the reason I don't like injections is, well, one, because you can't dose it for a woman, but two, it has this physiologic release factor where what happens is when you inject yourself with testosterone, you're going to get a spike in about 24 hours, and then it dissipates over about 3 to 5 days. So you get this sawtooth pattern release. And when you get that sawtooth release and you are overdosing, you're going to get sequelae of having blood pressure issues. You could have issues where your blood count goes up and you have to donate blood because your blood becomes more sluggish. It's called polycythemia, and that's not a good thing to be in. Now, pellets multiply that negativity by about 100 because pellets have so many problems. Pellets are, again, a male dose. There is no pellet for a female. And they lie to you, in my opinion. They will tell you flat out that it releases slowly. It's, it's safe. There's no studies to show safety or efficacy. Absolutely zero. These training courses I'm highly familiar with because I've spied on many of them. They teach overdosing constantly. And when you go to those courses, the whole premise of the course is that you're going to make money. The whole premise is how to teach you the business of selling the pellets. What happens is pellets cost about 4 to 5 times the cost of a monthly cream or a sublingual tablet. Any physician, in my opinion, that's putting in pellets is putting profits over patients. I did a study on my own practice. With the volume that I do, if I switched patients over to pellets, I would make an extra $25,000 a month. And man, that would be amazing. But I find it highly unethical to put profits over patients. And I just physically can't do that. If you look at the people that are also putting in pellets, plastic surgeons, med spas, dermatologists, ER doctors, they have absolutely no training in hormones. So what they do is they send one of their nurse practitioners to the course and they add it on as a service and they just do it as a moneymaker. It has absolutely nothing to do with caring for women or caring about what your hormone levels are, because the nurse that they send to this course doesn't know anything. She just knows how to put the pellets in and draw labs, but she's not adept with any of the HRT or dealing with the side effects. I deal with women all the time that get these damn pellets put in at a med spa and they have all these complications and they can't do anything about it. And I'll tell you what, once you put the pellet in, you can't take it out. And I have seen levels elevated dangerously high for 6 to 8 months after the pellets are put in. And as I said, there's no way to remove them. So you're screwed. You're stuck. Why anybody would want to do that? Not to mention the fact that it's a surgical procedure. You have to go into the office. They prep the skin. They make an incision with a scalpel in your butt, and they put in this massive trocar into your butt. They dig a pocket and they put this pellet in there. You have to do that every 3 or 4 months. I've seen infections, horrible infections. I've seen scarring. I've seen bleeding. I've seen the pellet get pushed out, so you lose the pellet. It's a horrible, horrible way to do HRT. So stay away from pellets at all costs. Know that the doctors, in my opinion, that are putting them in are putting profits over patients. It's a highly, highly negligent way to do testosterone replacement for a woman. Injections, I kind of put those in the same category. I would say it's the lesser of two evils. But again, injections were not made for women, they were made for men. They might be a little bit cheaper because injectable testosterone is dirt cheap. It's like pennies on the dollar. But again, not a great way for you to do your HRT. I would stick with creams, sublingual tablets, and capsules. They work great. I've been doing this for 25 years, have never had to use a pellet or an injection. My patients do great. Sometimes you got to tinker with things to find out the right dose or what delivery method's going to work for you. But again, in my opinion, there's absolutely no need for you to do a pellet or any other type of injection for your hormones. And the same goes for estrogen. No to injections. no to pellets. So, testosterone, again, I have seen women who come to me that are osteopenic or osteoporotic. Putting them on estrogen and testosterone is a 1-2 punch because estrogen, while it slows down bone loss, it inhibits a cell called an osteoclast. Osteoclasts eat your bone and help you remodel your bone. Estrogen slows down that process. So you're slowing down bone loss when you use estrogen. But if you want to build bone back, testosterone stimulates another cell in your bones called an osteoblast. Osteoblasts make new bone. So while you're slowing down the osteoclastic activity and decreasing the bone reabsorption, you're also increasing the osteoblastic activity and you're laying down more new bone. So estradiol and testosterone together are a 1-2 punch against bone loss, and it helps you build bone back. And I can't tell you how many times I've seen a woman with a DEXA scan that shows she has bone loss, and 2 to 3 years later, she's either gone from osteoporosis to osteopenia or osteopenia to normal bone density. Now, obviously, I also recommend that they do weightlifting and resistance training, get your vitamin D levels up, get your calcium levels up, and things like that. But testosterone should not be shied away from, even in younger women. Younger women suffer from low testosterone just as much as older women do. And it's because of lifestyles, it's because of diet, it's because of birth control pills. There's all kinds of ways that women have low testosterone. And I can tell you that it helps. And it may not be a long term thing for younger women, it might just be for a while to get your life back on track. If you're in menopause, obviously that ovarian production is not going to come back, that 50%. And if your adrenals are taxed, you may not be making testosterone from your adrenals. So I would say use testosterone. Now, there's also some health coaches out there, and probably a doctor or two, that are pushing this myth that you need to have your estrogen and progesterone balanced first before you start testosterone. That is a complete load of bullshit. They have totally made that up to make themselves seem like they know something that nobody else knows. There's absolutely no science to support that. I have women calling me all the time saying, my doctor told me I need to be on 3 months of estrogen and progesterone before I start testosterone. That's just a way to get you back into the clinic. That's just a way for them to sell you some testosterone program on the side. They can do it all at the same time. Now, most of the coaches out there can't prescribe anyways, but suffice it to say, it's just trying to sell another program. So keep that in mind. If you're low in testosterone, you don't have to have your estrogen. I have women that have breast cancer who can't be on estrogen, and I just give them testosterone because they're fatigued and they do fine. They do great. Now, keep in mind, another side effect of having your testosterone too high is a twofold problem. One is that testosterone can convert into a hormone called dihydrotestosterone. Dihydrotestosterone is much stronger than testosterone, and it has an affinity for the hair follicle. So as your testosterone levels go too high, you can be converting into DHT and then make you lose hair over time. The other thing is that testosterone can convert into estrogen if it's in high doses. So for women that don't need estrogen, for women that have breast cancer, you don't want to give them a pellet because if they convert into estrogen, that could be a bad thing. So keep that in mind when you're vetting your providers, when you're looking for information. Don't use pellets, don't use injections, but testosterone itself is perfectly safe. Again, I am in Austin, Texas. I see patients 4 days a week. I've been doing this for 25 years. I wrote the book, The Hormone Balance Bible. I know a thing or two about hormones, and I see patients via telemedicine in 48 states across the country. You call the office, 6. We get you set up. We'll order labs wherever you live. You'll meet with me a couple weeks later. We'll figure out what's going on with you. We'll get you back in the game. I hope you all have a great week. Take care.